Oh, perfect.
Perfect. Awesome.
We
So
got there in the end.
we got it. So once again, a quick introduction. We have Dr. Adam Johns with us. He is from United Kingdom. Welcome, Dr. Johns. He is working in COVID-19 ward. He himself got the COVID-19 as well, and he's fortunate, lucky he's with us and healthy. He is part of drbeen.com as well, and there are many beautiful lectures that are done by Dr. Adam Johns. So welcome, Dr. Johns.
Oh, thank you very much. I'm really happy to be here, and I'm looking forward to talking to you.
Perfect.
Yeah.
So let's start with it. When you got the COVID-19, what were your symptoms? How did it start? What was your experience?
So at that time, I was working on a internal medical ward. So I was looking after stroke patients. So it was a Thursday, and I developed a migraine. I didn't think anything of it, to be honest. I suffer from migraines anyway, so I just thought it was just one of those things. Then the next day, I was working a 13-hour shift, and towards the end of the shift, I coughed. But it was kind of one of those things where, obviously, it was constantly in the media around about that time, because it was when all the coronavirus started kind of descending, all the kind of mass panic amongst the UK. I'm not too sure how America was of it, but the Brits were very panicked about the whole thing. So I was wondering, am I just overthinking it? It's probably just, just one of those things where you just cough and you don't think anything of it. So then I went home, and then the next day, the cough had gone from just one or two to just continuous cough all weekend. And to be honest, I mean, the first few days, it wasn't too bad. I felt a little bit achy, a little bit tired, but nothing major. It just felt like a cold, I guess. I think it was around about the 5th or 6th day that I started to have this intense burning of my eyes, which not many people have really talked about. My eyes were burning so badly, and it was kind of around about that time as well where I started to develop some shortness of breath. So in terms of the shortness of breath, I've never experienced shortness of breath before in my life. I am fit and healthy, 27-year-old. The only thing as I said, I suffer from is migraines. So when I first started getting short of breath, I probably did the wrong thing. I started to panic because I'm not used to having that kind of feeling of chest tightness. Then I started to get the chest pain as well. So that was about day 8. And for those of you that have read about coronavirus, it does seem to be around about day 7 to around about day 10 that things start to go downhill. And that's how I experienced it, essentially. I had this shortness of breath that was almost, it was there constantly, but it would come in spikes where it was what I would put as like an asthma attack, it felt like. And those could last. So there was a fever as well. I felt quite warm. Unfortunately, I didn't have a temperature probe here to check, but I would assume that I had a very high temperature if I were to take it. What I did have, which was very fortunate, is I had an oxygen sats probe. So that is what I found particularly reassuring, because that's one of the main kind of worries, essentially, is in the people who develop coronavirus, is when they start to drop their oxygen levels. And I mean, it's one of those things where, from the patients I've treated as well, it can generally happen to anyone. So it's not just the people who have, comorbidities or things that they've got. People who've got asthma and COPD. They aren't just the people who are having problems with this virus. So this kind of whole thing went on for about 3 weeks.
Wow! So
and I ended up
3 weeks.
So the major part of it was 3 weeks. Actually, even afterwards, I was getting shortness of breath up to about 7 weeks. So it did last a long time.
Questions here about the shortness of breath. Was this at your regular activity you became short on it and normal talking, or was it during exercises? What was your experience with the shortness of breath?
So around about day 5, I'd pretty much become bedbound. I wasn't really doing anything. I obviously was not going to work. As soon as I kind of had these symptoms, I stopped going to work. And really, I would become short of breath just from walking from my bedroom down the stairs, which is a very short journey. It was on minimum exertion and stuff which usually I wouldn't think anything of. As I said, I'm 27, I'm fit and healthy, so those kind of things are no issues at all usually. The other thing I should mention as well is at the time as well, what we were doing is any healthcare workers that would displaying symptoms is we would get a COVID swab. So on that weekend, when I started to develop the cough and the shortness of breath, I talked to my manager and we got a COVID swab for me straight away. And then I got the results. I think it was about three days later. I think at the start we were still kind of working out how to process the high number of COVID swabs. But that came back positive, which was no surprise really, unfortunately to me.
And how was your feeling at that time? Were you freaked out? Were you like, oh my God, what is happening? Were you panicking?
I think for me, the major problem is around about that time, I was living with my parents as well. So I think I was mostly concerned about them. I thought I was quite naive, I guess, in a sense. I just thought because I have no health problems, I would be fine. And I was really worried about my dad because my dad has a few health problems, including asthma, and has problems with his breathing and lungs anyway. So I thought ultimately, if COVID was going to be an issue, it would be an issue for him. So when I started to develop symptoms, actually, my dad developed symptoms at the same time. Actually recovered after about 4 days. So again, that just proves the point that it doesn't necessarily affect people who have comorbidities. So on paper, it would seem that I would have easily bounced back from this virus and my dad would become very ill. Actually, my dad bounced back and I became really unwell.
Wow, so he bounced back in 4 days and you took
4 days.
And he has comorbidities and you do not.
Yep. My mum was even better. No way she didn't get to the. So, yeah, interesting actually how me and to the virus essentially. So you have me, 27, fit and healthy, which is completely wiped out by the virus. My dad, who has loads of comorbidities, bounced back very quickly from it. And my mum, who doesn't have any comorbidities, but she didn't show any symptoms at all. And just for reference, both my parents are in their 50s and 60s. So.
Oh wow, that is a very interesting thing to see, because we continue to say that people who are older age have comorbidities will actually have a higher chance of severe form of the disease and more intense outcomes. And here the younger child is suffering longer compared to the parents.
Yeah. Yeah, exactly. I think this virus doesn't discriminate, and I don't think just because, as I said, you got comorbidity doesn't necessarily mean that you will have a bad experience with it. Statistically, more likely, but still, not always like that.
Once you were positive, you do isolate yourself, start taking some medicine, symptomatic or COVID. What was your management?
So I was very early on when I got diagnosed. Coronavirus had only just come over to the UK around about that time. So I think it was about mid to late March, around about that time, just when coronavirus started kicking off. And essentially what I did was just sleep a lot. I was sleeping so much. And I think it was about day 11 that I contacted my family medicine practitioner. And she suggested that potentially I should start, thinking about potentially going to the hospital, because I was having these shortness of breath attacks every single day. My oxygen levels were absolutely fine, and I knew that the hospital was completely overrun. So I was trying my best to avoid going into the hospital, to be honest. typical doctor to avoid going to the hospital as much as possible, trying to treat myself, which is probably not what I should have been doing. It ended up, though, that I did end up going to hospital. I think that was about day 15, so that was quite late into the whole thing. And that was because I had the worst shortness of breath I've ever had, and it just got to a point where the pain was unbearable inside of my chest. On reflection, I think the pain could have been a combination just because I was coughing so much. However, when I went into hospital then, they did the standard test. They took bloods from me to look at my inflammatory markers, look at my infective markers, and they also did a chest x-ray. The kind of, when all this came back, they then found out my white blood cells were quite raised. They were about 15, not too bad. And then the chest x-ray actually was okay, but we think that at that point what they ended up doing was giving me some antibiotics because they were wondering whether I did have a pneumonia underlying as well. Just because a lot of the COVID patients seem to have been developing COVID and then having a subsequent pneumonia on top of it. And it just seemed weird that I wasn't really recovering, whereas a lot of the other people who had it in that area were seeming to recover at that point. Usually it would only take about a week or 2 weeks to recover. But unfortunately, I guess I'm just one of those people that just took a while. So we didn't have anything other really than the antibiotics. But thankfully that seemed to do the trick.
So, Dr. Johns, were you actually admitted in the hospital, or did they manage you as a patient?
So I was in A&E or emergency department. I think that's what they call her in America. So I was there for a day, but I had no oxygen requirement, and ultimately they gave me the choice. They were like, you can stay in if you want to, but I was really quite keen to go home. I think if I didn't have the oxygen sat probe, maybe they would have been more kind of keen to keep me in. But I think that the main concern, I guess, at that point was the oxygen.
And did they?
Because they were okay.
How much did they fall?
So I think they only went down to about 94, so it was completely fine. I think the main thing I found that when I was having panic, heart rate at 1 to about 100 per minute, and I usually 3 beats per minute. So I was breathing quite slowly. It wasn't like a panic attack. I wasn't breathing fast. Like, I was calm. So it was quite scary. But yeah.
And did you continue to have your headaches, or did they subside earlier than the remaining shortness of breath issues?
So I think the migraines lasted for a good 2 to 3 weeks. So they were pretty much there the whole time as well.
Oh, wow.
I just felt like no matter how much I slept as well, I was just continuously tired. So there was one day, for example, I genuinely think I slept for about 20 hours. Like basically the whole day and night.
I think that in my patients as well, that when I speak with them, they have no orientation of day or night. They're just sleeping, they're weak, they're feeling horrible, and they're just sleeping. So
yes,
a couple of questions from the team as well. So the questions are,
of course,
number one, any anticoagulations given to you? So I think that we over here talk about hypercoagulability as well. Probably that is more in severe and critical cases. You given any anticoagulants?
Yeah, no, that's a really good question, actually. So I think with my case, because I didn't develop an oxygen requirement, didn't have to go into hospital as such to be admitted, and also because I was still kind of getting around the house. I mean, it was very short of breath, but I was still able to walk around the house. I don't think they deemed that necessary. In our patients at the moment, any patient who comes in as an inpatient, we are prescribing anti kind of coagulation. because yeah, as you rightly said, they're very pro-thrombotic, aren't they? Patients with coronavirus. I think that's something which we very much started to pick up early on in the kind of pandemic. Really, that was essentially causing a lot of complications in these patients.
Got it. Please.
Thankfully, I didn't have any issues with that. I think I was quite lucky, really.
Absolutely. So I have a question of my own as well.
Of course.
Have you gotten your serology done lately just to see how long your antibodies stayed on?
So that was something I was going to look into. I haven't had it done, but I am looking into it. I would very much like to see if I have antibodies. That would be nice to know. I'm really hoping I've got it, and I hope that ultimately I will not get the virus again. Yeah. So
definitely the same hope here. I was actually looking to start a study as well, where we look at the patients who are in, let's say, January, February, March timeframe, and then we look at their antibodies now to see if they are still continuing to make their antibodies and what is the durability of that. That is a big curiosity.
Oh, no, definitely. And that would be really interesting to see. And even in the future as well, to see if they still have, do they still maintain that immunity, essentially? Because there's been some debate as whether if you do have immunity, is it lifelong, or is it for a certain period of time?
And just for our viewers, notice the SARS-CoV-1, that infection continued to allow the antibodies.
It's just cut out then. Sorry about that.
No worries. It's just network, I think, goes up and down. But SARS-CoV-1 had the immunity or anti-IgGs produced for about 3 years. I am hoping that for SARS-CoV-2 as well, our immune system would behave in a similar way, and we'll have at least 2-3 years of the immunity instead of done and you are open again. So,
I really hope
Dr.
so.
Johns will wait for your serology.
I'll keep you updated.
That will be excellent. So now if we can switch to your patients as well. So tell me a little bit about your setting where you're working. Is this an ICU? Is it an outpatient? Is it critical? What is your work type with COVID-19 patients?
So, as I said, when I was first diagnosed with COVID, I was at the time working on a stroke general internal medicine ward. By the time I came back to work, I'd been redeployed, so taken from my old job and put onto the coronavirus intensive care unit rota. I feel like that was a massive change. As you can imagine, going from working on general internal medicine to working on a coronavirus-based intensive therapy unit. I was a bit apprehensive before starting on there. Although in a strange way, I guess, having the coronavirus and having recovered from it was slightly reassuring, just in the sense that I was hoping I had some immunity. Some of my colleagues who work on the unit have, as far as they know, not had the virus, and that's quite scary. I think there's been so many different challenges really working on the unit. I think one of the main ones I really struggle with, and one of the biggest changes, is having to wear all of this personal protective equipment. You're absolutely boggling.
What is that experience of wearing a PPE and then donning and doffing it, and how do you manage in that?
It's strange now, because initially I found it quite intimidating. Like, there's loads of different things. I guess the main issue is you're so warm in there, and they're really uncomfortable. And if you're to a ward round on a number of patients, if you could be in there for about 3 to 4 hours, that they leave cuts on your nose, marks on your face, really, really uncomfortable. The other thing, which is a massive issue as well, is that actually I was working with a load of new nurses, a load of new doctors, and it's really difficult to make a connection with these people. They're all looking the same, essentially, because we're all wearing these kind of masks and hoods, and I found that quite difficult. The other thing as well to note is a very long period of time. And sometimes if you get called to an emergency, you have to think, you have to don really quickly, you have to doff, and it's just...
It is a pain.
Yeah.
It is a pain.
Yeah.
But thank you very much for your service. You're going out there every day. You are serving. And your colleague risk, then you're going through that discomfort and still living and helping. So thank you for that very much. So before we talk a little more about your patients.
Thank you very much.
You're welcome. I have a couple of more audience from the viewers. So one question is, pick up now here, vitamin D on your patients and yourself as a treatment and preventive measure.
So I've read a little bit about this. I think I was actually taking vitamin D at the time when I got it, so I don't know how effective that was. I wasn't taking a really high dose though, and I think some people have talked about taking the very high doses. As I said, I'm not an expert in coronavirus. I don't know if anyone really is an expert at the moment.
Nobody is.
Yeah. But I think at the moment, I don't think we're using vitamin D as a kind of preventative measure.
Got it.
Yeah.
The next,
I don't know.
Yeah, makes sense. The next question. Did you take Advil or Ibuprofen for your own headaches?
So around about this time, I'm not sure if America had the same thing, but UK, there was a lot of different headlines saying, and a bit of rumors saying that Ibuprofen and coronavirus made it more severe. And I didn't really know, I don't think there was any evidence really at that point for that. And I still don't think there is any evidence for that. I might be wrong. But just erring on the side of caution, I didn't. I just took paracetamol.
Perfect. And that makes sense. Even to my patients, while I know that ibuprofen may not be, the only thing known about ibuprofen is that it can upregulate ACE2 receptors, which may be the binding, which are the binding site for the COVID-19. That may be the only known thing. So I asked for paracetamol as well. So more questions for you. And there are so much beautiful questions, and people are so much engaged with your talk, and they're actually thanking us for this. So one very common question that I'm seeing here is what is the treatment regime? What is your treatment approach for the patient?
So I mean, that's a difficult one. It depends really. A lot of the patients I'm seeing are severely ill. So I have not worked on the COVID wards. So some of my colleagues are working on the COVID wards, and those patients are more kind of moderate. It's a step-by-step approach, essentially. So I think the main parameters we look at is the oxygen level. I would say that most patients, if they end up coming to the hospital, they have some kind of oxygen requirement. As I said, I didn't have an oxygen requirement, hence why I did not come into hospital and stay. So, you know, the first kind of port of call is you've got your nasal cannulae, or you've got your face mask. And usually, if patients are really struggling to maintain their sats and they keep dropping, and that's a really scary thing, really, is these patients, they'll be running about, I don't know, say the oxygen sats are about 94, and then suddenly they'll just start plummeting until they get to about 70. And it's terrifying seeing someone's oxygen saturations drop so fast. Usually, if a patient is unable to maintain their sats on face mask, we tend to use something called a continuous pressure mask, or CPAP, you may have heard of. If at that point they're still struggling, that's really when I tend to get involved, and my colleagues. So we'll come along and see whether the patient is suitable to be on a ventilator. As you can imagine, one of the main things that we were really worried about at the start of all this was the number of ventilators, essentially, and whether we'd have enough. Thankfully, touch wood, I'm not superstitious, but I am a little bit with this kind of stuff. We've been okay in our hospital. Things have been okay with the ventilators.
So
yeah,
please complete your thought. My apologies.
Oh no worries at all. So that's the main thing, I guess. Really, that's the first thing we try and sort out, is getting them breathing, trying to make them comfortable as possible. I think one of the scariest things I've seen, and I can talk about this, I won't obviously mention any patient-identifiable information, is there was another healthcare worker who had COVID, and I was looking after them. And we were asked to review this gentleman, and he was sat up in his bed talking to us. He had one of the CPAP masks on. It's quite loud. It's quite difficult to hear them. But he was completely compos mentis. He was completely with it. And he was terrified. He was so scared. And it was really, really sad. And we said to him, we're going to take really good care of you. We're going to take you to the intensive care unit, and we're going to intubate you, essentially. And I think in some ways, being a healthcare worker who gets this, it could be even more scary in a sense, because you know exactly what's going to happen.
Right. Correct.
And I think from that point, it does make you think, we kind of are in a kind of very scary situation here.
That is absolutely correct. So tell me this, so in these drugs, for example, hydroxychloroquine or ivermectin or azithromycin or doxycycline or lorazumab or IL-6 blockers, are these part of the protocol, or does it go from patient to patient?
So completely, it's from patient to patient. So every time we meet a patient, we will speak to our microbiology and infectious diseases doctors, and they decide the regime. I definitely don't decide that. I just prescribe it and just smile and nod. As you can imagine, every patient is different. One of the major things you may have heard of is pronin patients. We've been doing it laying on their front. It can work very well for patients with coronavirus. However, not all the time. So, for example, I've got one patient at the moment who is just not responding to being prone at all. Whereas I've had many patients before that have. That's quite difficult, because usually the majority of patients tend to like being on their front, and it tends to increase their oxygen levels. But when it doesn't help, it can make things a bit tricky.
Got it. So without putting you on the spot again, what is the most common medication that you've been seeing? And viewers, the medications that we are discussing here, as you can hear, Dr. Johns, that this is different, and a consultant looks at the patient's situation, then looks at the labs, looks at the cultures, and then decide what needs to be given. So please do not self-medicate yourself. But I'm curious, what are the most common drugs that you have seen being used, or you've seen that here you administered this drug and there was a dramatic response, if any?
No worries. I think the main thing, as we spoke about earlier, is your enoxaparin, so your anticoagulants. I apologize if I use a different term to you guys use in America. Most of our patients, well, actually nearly all of our patients, are on some form of antibiotic. I'm not going to say exactly which one, because honestly, every patient in the hospital will be on a different one, depending on what kind of reason they have the antibiotic for. Different hospitals here as well use different antibiotics. So my hospital particularly likes a medication called gentamicin. So some of our patients are on that at the moment. Some of the other patients are on clarithromycin. Trying to think what else. It honestly just depends on patient to patient.
Got it. So I guess I'm going to ask you this question straight. Do you guys use Drbeen?
I don't think it's regularly used.
Okay. You have tried it.
I think they've tried it. I haven't seen it regularly used. But again, I don't make those decisions. I'm not the consultant.
I'm not putting you in the spot in this way that you should vouch for or against. I'm just trying to figure out what are the places for these things. There is a question, again, going back to you. James Kelly is saying, which antibiotics did Dr. Adam take when he was sick in the hospital?
Clarithromycin as well. Seemed to work for me, thankfully.
Perfect for us. I'll go through the questions a little more and see. So there is John who's saying that I used sodium bicarbonate to treat COVID-19 and it was so successful in more than 2 patients. It is the best cure for COVID-19. So that is his experience. Do you have any experience with sodium bicarbonate? Did you guys see that on your?
No, not personally. I think that the one thing that we were really struggling with initially is a lot of people were saying to restrict the amount of fluids that you give these patients. So a lot of people were saying, oh, they've got acute respiratory distress syndrome, so don't give them any fluids. But then actually what we were, because we weren't giving them any fluids at all, like because people were so scared about giving any fluids, you can imagine that the effect on the kidneys is going to start to do damage to the kidneys. So it really is getting that balance right. Yes, you don't want to give too much fluid, but ultimately you don't want to give so little fluid that the kidneys are getting an acute kidney injury.
This was actually my next question, that the balance at this time that I am hearing from my friends now as well, that in the critical state, balancing the lung congestion with little fluid and then looking at the kidney, and then as the kidney goes down, you have to give the fluid, the lungs start filling up. So that probably is the most important and critical part of your practice at this time to manage the patient.
Yeah, no, definitely. I think that and the oxygenation is just key, really, to these patients. Yeah, completely.
Makes sense. Absolutely. So let me see what are the, so there is a, Kavi says, yes, restrict fluids. Nebu says you give therapeutic dose of enoxaparin or half dose. So I think that may not be a question. Is this a question that you can also answer?
So again, we have like a hospital set guideline at the moment. Kind of go off that. I'm sure different places are trying to do the similar things, but I still think there is a little bit of, I don't think there's any gold standard currently.
Makes sense, yeah.
Unfortunately.
Yeah, and I have been discussing that in my talks as well, that coronavirus did not come in with its own press. Please use this to handle it. And so we all at our places are trying to figure out what is the best way. So there are things know how to manage the patient, and then there are things that are new for this pathogen.
So I wish there was a way. I mean, as I was saying, sometimes like, you know, we do nearly exactly the same for 2 patients, and then one patient may die and one patient may live. And it just doesn't make any sense. That there is no real reason to it.
It's very unfortunate. 3 or 4 days ago, my class fellow, we both were together in King Edward Medical College. His son, 21, no comorbidities, very healthy, athletic, used to play sports. 3 days into it, with severe headache, migraine-like headache. They thought it's just headache. It would go away, frontal headache. And then within 3 days, from headache, he went to become dependent on ventilator, and within another day or so, he passed away. So,
jeez, I'm really sorry to hear that.
This is a dangerous time, and it's a very weird virus. So there's a question.
It is very scary.
Yeah. There's a question: what vaccines do you think might work? So we are going to ask you to read the tea leaves. So just your own opinion. We will not.
I think that's a difficult one. I know over here, some of my friends have just started entering a vaccine trial. I think there's this one where they do their antibodies initially, see if they've had any exposure, and then if they haven't, then they will assign them to either a placebo or give them the coronavirus vaccine that they have. I am not an expert at vaccines, but I hope it works.
Absolutely, same here. So there is a question from Panjot. Why does the fluid stuck in lungs, doesn't our mechanisms pull it out? I think what he's saying is that why do we keep getting the fluid? Can't our system just manage it?
That is a good question. I am not sure really of the answer to that.
Yeah.
I know that there was talk about the Cytokine Storm.
Correct.
And how that has just made things.
Yeah.
That's kind of where patients with coronavirus particularly become very ill with problems with the lungs.
Correct. And we have done a couple of talks in the past about it as well. that severe inflammatory reaction, the pneumonia, the lung damage, the vascular system damage in the lungs, all of that, then the cytokine storm, that causes the accumulation of fluid here. And to your question, Panajot, the fluid, it's not that our system is not taking care of it. Some of it is just in pus form, so it cannot suck it out, our body. And secondly, because there are so much injury in the lung, there is a continuous congestion that is developing. So even when our body is trying to handle it, there is just more fluid that keeps coming in. And that is why doctors like Dr. Johns, they have to have a balance to say how much fluid do we administer that it would not fill up the lungs, while at the same time, it is not so little that the kidneys start getting damaged.
Yeah, no, exactly.
Perfect. Let's see if there is any more questions before we break.
No worries.
Nabu says, will you be scared if you get another attack of migraine? That's a good question.
Yeah, that is a good question. I mean, I have had a few headaches recently, so I'm okay. Hopefully.
Yeah. And this is why I'm kind of interested to see your serology to understand that what was the durability of the memory B cells and the immunoglobulins themselves. So if you do get serology, please update us all. We will be.
I will indeed.
Yes. So there is another question or a comment from Philip. Korean doctor said the immune response needs to be just right, not too strong, not too little. That's correct. And
yeah, no, that makes sense.
Perfect. So is there, okay, so this is a good question from Manoj. Is there a role?
Yeah, I think for sure. Some of our patients have been put on steroids as well. Steroids can help certain patients. As I said, there's no gold standard. I don't think we're giving steroids to every single patient that walks through the door. But, essentially, we will try everything if things are not working on a patient. And steroids is one of those things that we could try. I guess it's a standard, if someone has any kind of respiratory problem, like asthma attack or COPD, steroids may be useful in that as well.
Makes sense. Totally makes sense. I have a very interesting question here, which I thought was, so that is from Akash. No, what is, so I'll probably not talk about the chloroquine itself because we talked about it before, but are the healthcare workers doing any prophylaxis?
Sorry, you cut off. Healthcare workers, did you say?
Because are your colleagues, are they given any prophylactic medication?
So I think currently at the moment, that's all we've been told is just have good hand hygiene and PPE. I'm very lucky that we have a lot of PPE in our hospital. We've been okay with that. We have no issues.
Makes sense.
Other than that, no, not really. Just trying to stay sane, trying to exercise,
stay healthy.
Yeah. Well, we're still very much, because I live in Wales in the United Kingdom. So we are very much in lockdown currently because we have a different government to England. So England has slowly started to relax his lockdown, but Wales is still very much in full lockdown.
Got it. And so Dr. Bill Gates is the commenter's name. If recovered, are you immune? So I think it's the same thing that I've been asking that, hey, did you get your serology done? Can we see if you're immune or not? So I'm hoping, fingers crossed, that you are immune.
Yeah, fingers crossed. Yeah, hopefully.
So there's a question from Anjali. What about second wave of coronavirus? Are you guys experiencing any lockdown, lifting the lockdown, people coming back? Do you see a spike pattern?
So I don't know what it's like over there in America, but in the UK, I genuinely think there's two groups, I feel like, of people. There's the group of people that are just listening to everything the government's saying and is actually doing a good job, staying home, socially distancing, all that kind of stuff is great. Then there's the other group that don't really care about coronavirus, think it's a hoax, and are having lockdown parties and are just using this whole time as, we have great weather at the moment, and this is never like this in the United Kingdom. It's constantly sunny, which is great, but also really bad because a lot of people are seeing it as a good excuse to go to the beach. So yeah, there are mass crowds at some of the beaches in England, and they've only just started to relax their lockdown. I'm not a politician, but
but as a medical professional, there's a scare that when people crowd together, it is possible to pass on the virus and become sick.
I think my honest opinion is that we will have a second wave of this. I think just from, I drove in to do my night shift on Sunday, and there was a group of about 20 teenagers stood around on the side of the road. So they're clearly not socially distancing. And then, they can go home, take it back to these.
Yes. And that is a sad thing. But I would like us all to be a little bit more responsible. Maybe just a couple of more weeks, hopefully we'll have vaccines. Hopefully we'll understand the virus more. Compared to what we knew in December, January, we know a lot more. So similarly, a couple of more months, we'll know better. So if you guys can stay home, I know it is difficult. I know it is depressing, but it is for your own good and your people around you for their good. I have a good question from a person. Shazia is her name. So she's saying, have you treated COVID infection in pregnant patients? So this has been a very common question from my viewers, that how do we manage pregnant patients of COVID?
So I've not treated them directly as such. I do, however, I carry like a COVID bleep, they call it. So any patient that comes into the hospital with coronavirus who's unwell, I get bleeped too. But we also get bleeped if any patient who is pregnant comes in with potentially coronavirus. So I have seen these patients, but I am not actively treating them because the obstetricians will take over the care of them. I'm not sure of the treatment for those, but I'm assuming it's very similar to what we're treating our standard COVID patients with.
Got it.
I think it's a very scary time for anyone who is pregnant currently. Going on to the obstetric ward, I think they'd be very nervous. And a lot of these people have not left the house at all until now, where they're about to give birth to their baby, which, I can't imagine how terrifying that must be.
I can totally see that. One more question. This is more of a personal question for you, Dr. Johns. So Dr. Bill Gates says, of course, he's Dr. Bill Gates. So just for humor, are you a soccer fan in UK?
Am I a soccer fan? I'm more of a rugby guy. So, Welsh is all about rugby, and I'm very much stereotypical Welshman. So, more of a rugby guy. But, I appreciate soccer.
Perfect. So, there's a question. Tayyib Mumtaz is saying, please ask him. Tayyib, what is your question? I'm going to try to scroll up to see where the question is. And Susan is saying that thank you very much for sharing your own story.
Thank you for listening. I really appreciate it.